Hi, I am Amy with the United Workers. I'm outreach lead in Western Maryland in the Western region. I'm here to share some of my testimony with you on our struggles, what we find our struggles are. We live in is what is considered the richest nation in the world, yet we cannot take care of our own people because it's not profitable. What do we do instead? Criminalize poor, raise prices on needed goods, and make healthcare big business. We allow the 1% to pit us against each other and put us in nice, neat little boxes and keep us separated. And they demoralize us and dehumanize us, take away our humanity. The issues is not black and white, gay or straight, Christian or non-Christian. It's a human issue. These issues are human issues. It's time we look past the titles, step outside the boxes, unite, organize, stand as one people. It's time we rewrite the script and bring the power back to the people. I have learned as a leader in the United Workers to be authentic and true to who I am. Not be afraid to speak the truth and to show true emotion. When I share my story, it inspires others to break through the silence and share theirs. These moments reveal that we are not alone, that we have more in common than what people really believe. At a protest we held around this time last year, revolving around an ordinance banning food in a local park because it's where the homeless like to congregate. There was an ordinance passing no eating in this park. You can't even have a bottle of water without risking getting fined because they want to criminalize the poor. And it's not just local ordinances that's being passed, it's even on the federal level where they are trying to criminalize being poor. About 24 years ago, I was young, pregnant, newly married. And my husband and I found ourselves in a situation when we ended up in a homeless shelter in Ohio. Because my child hadn't been born yet, we were separated. He was put in a men's room to sleep, and I was put in a women's room. They had a few bed rooms for families, but that was for children that was already born. My husband had health issues. He was diabetic with a seizure disorder. Even though the staff was aware of his health issues, they made sure he took his meds and everything. In the middle of the night, he had a seizure. When 911 was called, the cops showed up first and treated him like a criminal. They zip-tied his hands together, which caused wounds on a wound on one of his wrists. Once he got to the hospital, they was more worried about taking care of the seizure and the diabetes part of things. They did not clean the open wound and dress it properly. Thus, he incurred a infection called impetigo, requiring him to have medications that we couldn't afford. Luckily, he was able to get them through a doctor's office that helped the poor. They automatically assumed that it was drug related. And that was 24 years ago. My son that I was pregnant with at that time is 23 years old now. Will be 24 come spring, in the spring. So this is not a short-term now problem. It's a long-term systemic problem that's been going on for decades when we're still fighting it. Why? Because they keep finding ways to keep us separate, keep us pitted against each other. Because they know that once we come together, there's more of us than there are them. And if we come together, we will rewrite that script. We will flip the tables, and we will have the power that they don't want us to have. Who are they? It's the 1%ers that own everything, to tell us what to do, what not to do. This year has been our year to focus on our projects of survival, which a lot of it has to do with our work with food and making sure people have healthy, nutritious food. We found, No matter whether you're in Maryland or in our neighboring states, West Virginia, Pennsylvania, wages are low. People simply can't afford to buy food, pay high rent prices. Average rent in our area is roughly around $1,000 for a 1 or 2 bedroom. There are a few, if you can get a private landlord, that may be a little lower, but you're paying rent. A lot of times utilities have been going up. I'm sure that's a nationwide thing, not just local. We're finding people are struggling, elderly, with the Medicaid cuts, with cuts to different programs. Our seniors, our young families with small children are suffering. They're not being able to have what they need. We're in our fundraising, and we've been trying to raise funds to help support our local produce drop because of cuts to the USDA, the program that runs that particular, allowing people to get fresh produce. They're going to start charging $500 a month. Every organization that participates in this, but most of them are nonprofits or their churches, will have to pay $500 just to be able to help the community get fresh produce. We're helping in our different areas where we're at. We're helping offset that cost because that's what needs to be done. Our people are starving. They're feeling alone. And that's why it's so important that we do what we do, be it here locally. We've had people come from Pennsylvania, from West Virginia, because where we're at here in Maryland is right in Appalachia. And we may be tough, but we are very friendly people. And our neighbors are starving. We do everything we can to try to help them. And this is an ongoing fight. I'm sure wherever you're at, whoever, whatever state you're in, you are seeing the same struggles we are. I've lived in different states, and it's all the same. Your shelters are overran, or they have criteria. Not everybody feels comfortable being around other people, And it's sad. There is no reason for this. Why our government, be it local ordinances, state ordinances, federal laws being passed. You can't sleep in your car if you have too many items in your car. Where it looks like you're living in your car, even if you're not. You just haven't had a chance to, maybe you're just moving or whatever. They want to fine you, throw you in jail. Why? Because you don't fit in their box. And it's time to say enough is enough and stand together, unite, and take back the power and flip that script.